Hey everybody, how are you today? My name is Conrad Page. I am the Director of Growth for Field Trip Health, and I'd like to welcome you to our Instagram live session. Today, it's my pleasure to introduce to you two of our medical providers. I have Dr. Michael Verbora joining us here, along with Dr. Kazi Hassan. A little bit about our doctors today. Dr. Verbora is the medical director at Field Trip Health. He's an assistant professor of medicine at McMaster University and a professor of cannabis at Seneca College. He's really passionate about consciousness enhancement as a tool and using psychedelics and medicine for health and wellness, and also has a special interest in telehealth medicine development and expertise. And I'd also like to introduce Dr. Hassan from our partners at New Life, and he is leading our Field Trip at Home program. He specializes in physical medicine and rehab, and his current focus is in integrative psychiatry, and particularly in the field of psychedelic therapy, which brings him to Field Trip Health. He has a goal to translate clinical research and apply analytical frameworks to help drive better patient outcomes. And really is inspired by transformational and sustainable changes that promote overall brain and mental health and wellness. And so I'd like to welcome him as well to our conversation today. As we get started, as I mentioned, I'll be moderating today's event, and participants are welcome to answer any questions or ask anything they might want to know about the treatment that we offer for Field Trip at Home. And I'd like to just tell you a little bit about us. Field Trip launched our at-home ketamine therapy program to complement our ketamine-assisted psychotherapy services that are delivered in our 12 health centers. We've partnered with New Life to create Field Trip at Home, and we really want to bring this breakthrough treatment of mental wellness to your home. So today's chat will allow audience members to ask any questions. I'll be paying attention to those. And I'd love to kick off with our very first question of the day, which comes from Sophia, who wants to know, can I do ketamine once and see results, or do I have to go more than once?
Yeah, I can take a stab at that one. Thanks, Sophia, for your question, and thank you, everybody, for joining us today. Ketamine is really a remarkable molecule. It's an old medicine that we've repurposed, and it's leading what we call a revolution, essentially, in mental health. And what these molecules, psychedelic molecules, are doing, particularly ketamine today, is it's really inviting healing back into medicine and back into mental health. Now, what we know with ketamine to date, based on the clinical evidence, the best scientific evidence shows about 4 to 6 sessions to generate the results that we're looking for, which is about 50 to 80% improvement in depression, anxiety, or trauma-related scores. So while you may get benefit after 1 or even 2 sessions, the best evidence would suggest that you do a minimum of 4 to 6. So I hope that answers your question.
Thanks, Dr. Verbora. Dr. Hassan, what is ketamine therapy like, and who do you characterize it as the best kind of who it works best for?
Of course, those suffering from depression, anxiety, PTSD, ketamine has shown tremendous efficacy in the really difficult to treat populations. So people who have failed multiple antidepressants have a very high efficacy rate with ketamine. So that is very encouraging.
And maybe you can tell me a little bit about what is Field Trip at Home, and how does it work?
So Field Trip at Home brings the ketamine experiences, of course, into your home. We expanding access through telemedicine. We've built digital tools for the patient to prepare experience and then integrate that experience. So it's just an extension of what happens at the Field Trip Health locations, but in the home setting.
I see. So for someone who's going through Field Trip at Home treatment, Will their clients be working with doctors and therapists?
So we have licensed medical providers to diagnose and treat, and then really provide that medical education to prepare the patients for their ketamine experience at home. Mm-hmm. And then we have integration specialists to guide them through the processing.
I see.
Mm-hmm.
Can you tell me a little bit about those integration sessions actually? How do those work?
Yeah, so we believe that healing happens in community. And so we've developed cohorts of patients to go through the process. They'll attend preparation sessions where they bring their sitter, their friend or family member who will be with them physically during the experience. And then after their experience, we'll put people into cohorts, and then each week we'll cover different topics of mental wellness and really have our integration specialists facilitate that conversation.
Excellent. So for someone who's considering treatment, how does the qualification process work? How would I know if I qualify for this?
Sure. So when someone is signing up, we have a welcome team that will walk you through a number of questions on a discovery call and make sure that you're appropriate for ketamine therapy. Ketamine is a very, very safe drug, but we'll verify with your medical team, your psychiatric team, if necessary, with our patient safety and eligibility coordinators to make sure it's appropriate for you to do at home. And then if not, we, of course, in this partnership, able to refer to the field trip health clinics for in-person therapy as well.
Excellent. And maybe this question could be to both of you. Like, why are we working with ketamine as a medicine versus like some other stuff out there? A lot of people question around, like, say, ketamine versus psilocybin, which is maybe becoming a little more popular.
Mm-hmm. I can take that first. So ketamine, the way we're using it in these, call it low to medium doses, we've known for about 20 years it has antidepressive properties. But we're obviously going through a psychedelic revolution. The evidence coming out is it's beyond exciting when you see data being published with a single dose of psilocybin potentially curing end-of-life anxiety for 5 years. That's a remarkable paradigm shift in mental health. So this is obviously generating a ton of interest in psychedelic molecules and psychedelic therapy. It's important to recognize that this is an evolution now, a revolution with an evolution of different substances. So today, really, the only legal kind of psychedelic drug that we can use in most jurisdictions around the world is going to be ketamine. And that's a synthetic anesthetic drug that we use. It's extremely safe, and it produces very similar effects. Now, there's some nuance around that. I know at Field Trip, we have an Amsterdam clinic, which we can use psilocybin truffles. So you can get psilocybin-assisted psychotherapy, but you'd have to travel to specific jurisdictions for it. But if you look over the next 2 to 3 years, there'll be way more than ketamine available. There'll be psilocybin, there'll be MDMA, and then there'll be even other new synthetic drugs coming out.
That's great. Dr. Hassan, did you have anything to add?
Well, we are very fortunate that ketamine has such a long history of safe and efficacious use, through the FDA trials and just the long-standing clinical history. So the benefit of having a pharmaceutical drug is that you have the medical container for it, which of course people are exploring psychedelics for consciousness and healing outside of this medical container, but as medical professionals in the U.S., this is what we're limited to right now.
Actually, I love that you brought that up, the idea of the container. Maybe you can tell us a little bit about what do you mean by container? And we do have a question that came in from someone who's a certified CAF facilitator who wanted to know, how do we provide set and setting and integration before, during, and after treatment?
Of course. So we have preparation groups that run multiple times a day. In those, of course, we're inviting the patient and their sitter to really understand intention setting, what the environment should be like. We've invited a musicologist from Spotify to really create, beautiful playlists that correlate with the different intentions that one can set. And the process of integration actually begins right at the medical consultation. So we are really priming people to be very intentional about what they're doing. What is their story? What is their relationship with themselves and others? And how can we use ketamine as a catalyst to really promote that deep healing?
Excellent. Do you have any, can you actually provide it, do you have any kind of like thoughts around like how like people are successful with this intention setting, and is it something that just stops and starts, or is it something that you kind of like revisit and integrate past treatment?
That's a good question. So if you look at the literature with substance use, unfortunately, society has narrowed down substance use into just the substance. And that's very inaccurate. So the literature on substance use shows us that there's really three factors that depend on how one will react to an experience. And that's the mindset, the environment that you're taking it in, and then obviously the drug that you're taking and the dose that you're taking. And so a lot of the nuance out there, unfortunately, is lost because we just say, oh, this drug is bad no matter what, and this drug is good no matter what. And that's not true. You can use the same drug, but in completely different mindsets and in completely different, experiences, and have two totally different outcomes. One could be, good, one could be bad, one could be, neither good or bad. But when you go in with an intention and you're, priming your brain in a certain environment that you create a safe space, what that does is it starts to allow the brain to create these new neural connections. And ketamine is a neuroplastic agent, which is so nice. And then when you pair that with psychotherapy, which is also neuroplastic, what we're really doing is we're trying to allow the brain to rewire in a very fast fashion to consider a wider range of possibilities. And that intention just kind of brings with you kind of the most intense thing typically that people are experiencing that is limiting them from living their full potential.
That's a great answer. Thank you so much, Dr. Verbora. We did have a question around medicine and dosing, specifically for field trip at home. And Dr. Hassan, what happens if because as I understand it, a client has to have like a trained sitter with them when they're medicine at home. And can you tell me a little bit about the training that they receive? Specifically, what happens if the patient becomes ill during treatment, say nausea, for instance? How is the sitter supposed to react?
That's a great question. So during the initial medical consultation, we're counseling the patient on, the role of the sitter. And of course, we send further documentation to the sitter, and we invite them to our preparation group so that they're very comfortable with what the roles and responsibilities are. These sitters are, of course, friends and family members. They are not medical professionals. So in no way are they acting medically, right? So it's really about, not intruding on the experience, like providing that supportive social support. Really, that is the main function of the sitter, right? And if, a patient after their experience needs to rise and go to the bathroom, you may have impaired balance and, some blurry vision. So we just want to make sure that someone is available to the patient, just to make them safe. Now, in terms of the medical, side effects that our patients experience, nausea is among one of the most common, right? But we pre-medicate with Zofran. Very, very rare to, I would say, have to respond in any way other than just, supportive social care, right? So these patients and their sitters have reviewed the informed consent, so they know exactly, what can arise. Now, if there were a true medical emergency, in 40,000 experiences over the past 4 years, we've not had one medical emergency at home, right? Not one instance where EMS had to be called, so we are very, very fortunate that ketamine is so safe to be administered at home.
That's fantastic. And that's a lot of treatment. So that's great news to hear, that people are able to safely work with it at home as well as in clinic. Maybe I've got a quick question for you, perhaps Dr. Verbora. How does somebody decide between doing ketamine therapy at home versus ketamine-assisted psychotherapy in clinic? What are some of the considerations, especially around like maybe cost or location? How would somebody decide between in clinic and at home?
Yeah. Well, for the most part, if you look at the outcomes, we're looking at very similar outcomes. We've compared data between Field Trip and New Life, and what's really remarkable is independently we compared our data. We get almost exactly the same outcomes in terms of 50 to 60% reduction in depression scores after 4 to 6 sessions, 50 to 60% reduction in anxiety, and as well as post-traumatic stress. So from a beginner's perspective, whether you choose one or the other, or you're approved for one or the other, the good news is your outcome's likely to be very, very similar. So I think that's the most important thing that you should consider. The second thing that you should consider is probably where are you kind of in your own journey? And how comfortable do you feel about doing something like this at home? What support structures do you have? And what support do you think you need? And if you're someone who thinks that you need a little bit of support, if this is relatively new to you or you don't feel as comfortable, then maybe doing it in person at the beginning is kind of the right approach for you. There might be instances where people have certain like chronic medical issues or on a number of medications, and we want to monitor a little bit closely. And so an in-person might be recommended. But as Dr. Hassan was saying, after 40,000 doses, no emergencies at home, by and large, the vast majority of people would be very capable of doing both. So I think you just kind of look at those variables. And the other thing that I'll bring up, which is a little bit more complicated and it's more anecdotal, but we know that people with really, really deep histories of traumas, sometimes the psychedelic process can be a very difficult experience. And it's not a bad thing to have a difficult experience because you're processing trauma, you're digesting it. Good things don't necessarily come easily. But sometimes when you have that big trauma that's been buried under the surface, having that little bit of extra support in person can be beneficial. That's not to say that you can't get benefits at home. It just might be a little bit extra more beneficial to do it in person.
That's great. And I know we've kind of touched on it a little bit, but just in case for those who have joined the session a little bit late, maybe you can tell me a little bit more, like how do I qualify for treatment, whether I'm going to in-clinic or field trip at home? What does that process look like, just at like a high level?
Sure. So, Dr. Verbera, I can start with the.
Yeah, go for it. Yeah, please.
But I think we've made the process very simple. So just signing up for a discovery call with one of our educated welcome team members can really help you decide, is the at-home treatment going to be best for you? And then after you've gone through that process, we have our patient safety and eligibility coordinators work with your medical and psychiatric team to make sure that you're safe to participate at home. So, we handle all medical screening in our onboarding process.
Yeah. And at Field Trip, we do the same thing, right? We have a psychiatric screen, make sure that this is indicated for the individual. We make sure there's no contraindications. There's 4 or 5 rare things we don't see too often. The big one being like, you just have to make sure your blood pressure is well controlled. And then if those are checked off, then, we go through a quick medical screen and then, you meet your therapist and you start to establish rapport and then you come in for your first dose.
And Dr. Verbora, can you clarify who's best helped by this treatment? What's like the conditions that we seek to, the primary conditions we seek to treat?
Yeah. Well, so the challenge is because we're in the middle of this paradigm shift, we're kind of got one foot in the old world and I got my other foot in the new world. And so the old way of looking at things is that, everybody's got a different mental health condition. You have depression, you have anxiety, you have OCD. And I just think that's going to be such an outdated model in 5 to 10 years to like compartmentalize people into a label. Like it's just pain for the brain. It's pain and suffering that we all experience, and how it manifests for you or how it manifests for me could be different. So if you look at the literature today, it's going to be in that old model, and it shows that predominantly in the most severe forms of depression, that's where we see the best outcomes. But we also have lots of evidence now that it helps with anxiety disorders and it helps with trauma-based disorders. But I think, so in general, I would say the evidence is pretty good for many of the most common mental health issues. The one where it's probably not as helpful is probably for psychotic-related disorders, because the brain in a psychotic disorder is a little bit too loose, the network. So you want to actually strengthen connections. You don't want to loosen them up. Whereas in depressive, anxiety, OCD, trauma disorders, the brain is a little bit too rigid. And what these psychedelics do is they open up the brain a little bit and start new connections. So they loosen the networks. But I bet you in 5 or 10 years from now, we'll have way better quantitative tools to just look at someone's brain and be like, okay, you have a very rigid, structured brain. And that's not allowing you to kind of process things. And I think we'll kind of get away from some of these labels, and we'll have better ways of kind of identifying the way that your brain is actually connected and working. And then that way, we don't walk around with 10 different diagnoses, and we just admit that, we have pain and suffering that manifests in different ways.
Mm. Excellent answer. And Dr. Hassan, did you have anything to add there?
Oh, I love what Dr. Verbora just said. Like this idea of the DSM, the Diagnostic Statistic Manual, characterizing, these disorders. We're all human. We all have a sense of self. We all have this conscious experience of life. This existential distress, right? So like the sense of self as a source of suffering. Like you think of Buddhist philosophy. Like what do people with a a mindfulness practice hope to achieve, right? Is to quiet down that like inner narrator, that harsh critic, right? So one of the most interesting things about depression is, we notice that depressed and anxious populations have higher default mode network activity. These are the areas of the brain that are responsible for that voice, right? And we know that ketamine therapy can actually decrease DMN activity. So Dr. Verbora talking about like these functional neuroimaging, that we could be able to like really see like the areas of the brain that are dysfunctional. So there is actually like a functional connectivity that ketamine can really help quiet in the brain, that produces more peace, and that's above and beyond all of the spiritual meaningful experiences that people have and connect with.
Mm-hmm. Yeah, and I would add. Oh, sorry. Go ahead.
Oh
no. Finish your thoughts. Sorry.
The other kind of neurobiological thing. One of the etiologies of depression is this, high stress, like stress-related changes in the brain actually lead to cortical atrophy, like shrinkage of certain brain areas. And we know ketamine, through its neuroplasticity and synaptogenesis, can actually reverse those stress-related atrophies.
Yeah, I was going to add that, kind of comparing this old and future model that we're kind of building as we go through it, right? We're learning. And I always say, psychedelics is to the brain what, the telescope is to space. Like you're learning as you go through. And the old model is biomedical. And that
Mm-hmm.
model is you have a symptom and it's biochemistry that explains it. And I think that's such a primitive way of thinking, because when you really connect with humans as a doctor and you really understand at the core of what's in their pain and suffering, whether through its physical or mental health issues, you realize that that people are way more than just biochemistry, that we're biopsychosocial spiritual people. And that's the beauty of psychedelics, is it's bringing in that biopsychosocial spiritual continuity that make up all parts of you. And I saw some questions through the chat there about the different forms of ketamine or S-ketamine. And so it's important to recognize that not all ketamine is the same, because some are still operating with the molecule ketamine, but they're using that old biomedical approach, right? So they're just saying, here's some nasal spray, you don't need any therapy, and the medicine's gonna make you better. But I bet you with more studies, we'll start to see that if you're just taking the medicine without integrating and doing it with the proper biopsychosocial spiritual, you're going to end up becoming reliant on it, no different than if you take a pill every day for your mental health or your chronic symptoms. Whereas if you're using ketamine more as a catalyst and you're using it to really get the brain to change, and then you're integrating it with a psychotherapist, you're going to get way more durability because you're working on that psychosocial spiritual approach.
That's a really interesting and excellent distinction, Dr. Verbora. Thanks for highlighting that difference between like the biomedical approach and this kind of new biosocial, psycho-spiritual approach that kind of works on the holistic individual altogether. And I love your analogy about how psychedelics for the brain are like a telescope for space. That's one way to think about it.
It really is. Like we're like we're very primitive in our thinking when it comes to knowing our brain. Like it's amazing, even though, you know, we have all this imaging and stuff. We still have such a basic understanding of the human brain.
Mm-hmm. Yeah, and actually on that thread, I wanted to ask a little bit about how does our ketamine at home or ketamine in clinic or ketamine therapy in clinic interact with like existing medications, like SSRIs, for instance. One person asked if this treatment could help them get off, for instance.
Yeah, that's a great question. The beauty of ketamine is that even though it's a psychedelic, it can be safely used with antidepressants. So it's really one of the only you know, psychedelic molecules that can be used safely with antidepressants, SSRIs or SNRIs. Other drugs like psilocybin or MDMA could increase the risk of serotonin syndrome, which could be very toxic. And so those aren't recommended if you're taking antidepressants. So there's always going to be a place for ketamine, no matter what new molecule comes to the market, because of its safety. But yeah, the number one, probably one of the main goals that I see from patients in our clinics is that you know, SSRIs can really help them temporarily, short term, and it helps them with symptoms, but it robs them of being able to fully experience the spectrum of emotions. And so while it stops them from feeling so bad about themselves, it also blunts them from feeling good about things. And so they operate in this narrow range of an emotional range. And so if we can get people off safely, and ketamine has really helped them, it'll give them back that emotional range. And that can be really therapeutic again for people who've lost that and recognize that that's impairing their ability to live fully.
Mm-hmm.
Excellent. Dr. Hassan, we have a question from Gilad. He asked, how would targeting the serotonin receptors differently affect the treatment results? Could different serotonin cascade drugs have different results in therapy?
Could you repeat that last line?
Absolutely. He asked, how would targeting the serotonin receptor differently affect the treatment results? Could different serotonin cascade drugs have different results in therapy?
Well, of course, ketamine is a receptor antagonist, so it works on a completely different receptor set than serotonin in your typical SSRIs and MAOIs drugs, TCAs. So that's probably a big reason why it's so efficacious in treatment-resistant depression. It's working on a completely different receptor set. So for people being on SSRIs, as a number of our patients are, you know, we will find, you know, like what implications that has on their ketamine treatment. But you know, there's nothing currently to say about the role of you know, serotonergic drugs combined with ketamine, at least in this model.
Okay, thanks for that answer. Dr. Verbora, did you have anything to add before we move on?
No, just most of the studies done on ketamine are people taking antidepressants. And so just recognize that the research that's being done that shows it's working, about, you know, 60 to 80% of the time is done in people who have the most severe forms of depression, who are already taking medications. So if you have that, like, that's a lot of hope that ketamine could be successful for you. And if you're not as severe, you haven't been through so many medications, it's logical to assume that it would also be very beneficial for you as well.
Mm-hmm. I want to follow up with a question around the ketamine itself. Can you maybe explain the difference in how it's administered, either in clinic or at home?
Of course. So at home, we're using rapid dissolve tablets. We're having the patients swish the medication in their mouth, and then we get the maximal fraction you can from just the absorption in your mucous membranes in your mouth. So we estimate around 30% bioavailability there, and that's compared to the intramuscular doses you receive in the field trip health clinics.
Yeah. So our US clinics, we use mostly intramuscular, which can be a little bit faster. It can be a little bit more tense because it peaks a little bit more. And it's a little bit more consistent. But in our Canadian clinics, we've done 10,000 doses with lozenges, rapid dissolve tablets, the same ones we use at home, and we get very similar effects. We just modify the dose so that they end up being equal, essentially, in the bloodstream by just doing a simple calculation.
That's great. I'm going through the comments and questions here, and I do want to call one out specifically. This is more of a comment than a question, but I just think it's important to ground it. This came from Peach and Velvet, who says that field trip has literally saved my life. That's a very important. I want to thank you for sharing that.
Thank you.
And maybe we can talk a minute about what are some of the client outcomes. I've talked to clients in the past. They share really touching stories and big personal changes that other people see. But that sentiment from Peach and Velvet, is that a common thing, or how do you take that, Dr. Hassan?
It is. I've had so many patients now, specifically with suicidal ideation, who have had miraculous treatments with ketamine, and that is truly the most gratifying part of the work. We measure our clinical outcomes with changes in validated depression and anxiety scores, what Dr. Verbora was alluding to earlier. So we've seen a 64% clinical response rate in patients who have done the clinically recommended 6 doses of ketamine. As he mentions, that's the standard protocol over the last few decades. And this is, of course, using our sublingual rapid dissolve tablets. We're very, very encouraged by what we see there.
Mm-hmm. And Dr. Verbora, do you have any kind of patient outcomes that you maybe wanted to touch on or highlight at a...
Yeah, thank you for sharing that, and it's an honor to be take part in one way or another in that experience for you. It means a lot, and that's what we're really dedicated to. Is we really want to help people transform themselves, and the philosophy of psychedelics is that we all have our own inner healing wisdom or healing intelligence, and we just forget how to use it, right? We lose it because we get busy, we get distracted, we get, programmed in so many ways in society to believe certain things and pushed into different corners, and, social media and all that kind of also can exacerbate that at times. And what psychedelics do is it really opens up your brain. It gives you more of like a childlike experience where you can kind of look at things again with fresh eyes for the first time and formulate new opinions. And what that usually does is it alleviates and distances you from a lot of the suffering that people experience. And so, yeah, I've been blessed to meet people who've, a lot of like healthcare workers, like I think of, first responders who've responded to very difficult traumas and have had to take years off of work. Being able to go back to work and do the thing that they love again because they're no longer afraid to do it, and to give back obviously to this community, and the stories just go on, and I think that's important. Like, you got to go in with an open mind, and you don't know what type of outcome you're going to get. Everybody's going to be unique, but you have to be prepared, and that's what we do, is prepare you for a transformation. And so you have to build space in your life when you're doing these medicines, and you have to build time to do the hard work, because if you want to maximize the potential of transforming your life, it's going to be a lot of transformation on your part and commitment.
Mm-hmm. Mm-hmm. And maybe we can just spend a minute on how the protocol, whether you're doing ketamine therapy at home, or if we're doing ketamine assisted psychotherapy in clinic, maybe a little bit about how the protocol is used, and what a potential client could expect if they started do treatment in clinic.
Yeah, I can start with the in-clinic. So the protocol typically is a psychiatric intake assessment that's usually done virtually. That's to make sure that you're a good candidate and there's no contraindications. The second appointment is meeting typically with a therapist, and that's to kind of build rapport and build trust and establish that relationship. And that's also for your intention setting and your preparatory session. So, managing expectations, understanding, how we're going to give you the ketamine. You're going to lie in a chair, we're going to give you eye shades, we're going to give you music, what to expect, what to do when you're feeling certain things, consent for things like, hand holding or hand on the shoulder. There's this whole process we go through. And then we invite you in for your ketamine sessions, and we do Typically 2 ketamine sessions followed by an integration session. And let's say that typically plays out over the course of a week. And then most people will repeat that 3 times for a total of 6 ketamine sessions and 3 to 4 integration sessions. And that's kind of like the field trip gold standard protocol.
Excellent. Thank you for that answer. And Dr. Hassan, what would I expect starting to work with you and the at-home team?
Of course. So you'll be met with our client success guide who will schedule your appointment. You'll have your initial medical consultation through telemedicine. And then after that, we'll evaluate your history with these types of medicines, your medical comorbidities, and then we'll determine what's the right discovery dose. So it's typically a lower dose initial experience, and then based on the experience record details after you've had your experience, you go through and you give a detailed account through our app so that your provider can determine what is the ideal next dose of medication for you. So we go through this dose discovery process, sending 1, then 2, then 3 shipments of ketamine. So in that process, we're really establishing what is the psychedelic threshold and really like helping you integrate along the way and just managing any side effects that can emerge.
Mm-hmm. And so if it's determined that I'm a fit for a program and I qualify for treatment, how long would I have to wait to actually start my treatment if I were doing the at-home program?
We have next day availability in some states right now.
And actually, could you recap what states our at-home is available in?
Sure. We're in 10 states, Florida, Texas, California, Colorado, Washington, New York, Massachusetts, Tennessee, Georgia, Connecticut, soon to be.
Excellent. Thank you for that. And Dr. Verbora, kind of the same question for you. If I'm going to field trip the ketamine-assisted therapy in clinic, what does like my timeline look like from deciding I'm ready to treatment and go through the qualification process to actually getting inside of it?
Yeah, so we can see you relatively quick within probably 7 to 10 days for that psychiatric assessment. Each clinic's a little bit different as to how far they're booking out. I know our busiest clinics, typically Toronto and New York can be about a 4 to 6 week wait to kind of get your first session for ketamine. You will meet your therapist within, a week or 2 of your first psychiatric appointment, assuming you're approved. And then some of our other clinics have a little bit more capacity at this time. So it might be just as short as a week or 2 to kind of get started. And would it be helpful to kind of list off our clinics and where they're located?
Yeah, that'd be great if you wouldn't mind.
Yeah,
please.
Just for people interested. So on the East Coast, New York, Chicago, Atlanta, Washington, DC, and Houston. And on the West Coast, we have LA, San Diego, and Seattle. And then in Canada, we have Toronto, Vancouver, and Fredericton. And then if you're really adventurous, you can get to Amsterdam and try our truffles out there and psilocybin-assisted therapy.
Yeah, love Amsterdam Clinic to make sure we give it a little bit of love on this.
Absolutely.
Great group. So maybe we just talk for a few minutes around cost. One question I saw at least twice on here is this treatment covered by insurance? Maybe Dr. Verbora, we can start with you on that.
Mm-hmm. Yeah, so typically we're billing we're billing patients for the service, which is typically billed for inpatient psychotherapy. So we're not billing you for the ketamine. And then with those psychotherapy bills, you can submit that to your insurance company and get whatever percentage of that back. And that's really just dependent on your benefits, right? So we have some people who have really great extended benefits who can get the whole program covered. And then we have other people who can get, 50 to 60% covered. And then others who don't have any type of coverage will have to pay 100% out of pocket.
Okay, thanks for that explanation. Dr. Hassan, how does payment work when you're doing a field trip at home?
So you would sign up directly with our welcome team. You can do financing if you require, but It's a one payment for either our 1 month or 4 month program.
Excellent. Yes. And yeah, for field trip, our clinics, we do have that payment program available as well for people to make monthly payments. That's correct, right, Dr. Verbora?
Yeah, we've launched a payment plan to help people make this more accessible.
That's really great. So Amy asks, typically, how many treatments would someone expect to get? Maybe Dr. Hassan, I can start with you. If they're doing the at-home program, how many treatments would look like?
Our 1 month program is the standard clinical 6 doses. And then what we found to be very, very helpful is an additional 3 months of once a week maintenance therapy, so that we made a 4 month program, which is the New You program. So that's been quite successful for us. So people can upgrade at any point.
Great. And Dr. Verbora, same question. I know you did touch on this a little earlier, but how many treatments would someone expect if they're doing ketamine therapy in clinic?
Yeah, so typically we'll recommend, the best evidence again is going to be 6, and that's what we see. So we typically recommend 6. That doesn't mean that you can't get a lot out of 4. And the truth is, I consider it, layers of an onion. And so, 4 sessions will allow you to peel back a couple layers, but the extra 2 sessions will allow you to go deeper. And then, a month or 2 later, if you wanted to come back for 1 or 2 sessions to keep working on that. It really just depends, your starting point and where you want to be. And if you want to really, really deeply heal and maximize your potential, you might do a little bit more over the period of, let's say, 6 months. And if you're just looking to alleviate, some of the suffering and build a little bit of space, you might not need as much. So it's also really going to be dependent on the individual goals.
One thing that you kind of both touched on a little bit and maybe give a little space for is, how does this treatment that we offer go beyond maybe the symptoms and try to focus on some root causes? I feel like that message resonates with a lot of people, that it's not like a Band-Aid, that we go deeper, and that this is really hard work. It's not just, it's not all fun and games. That treatment is hard work, and you have to do some personal reflection. So how does that help get to root causes? And is that what the point is?
Yeah,
Absolutely.
yeah. So traditionally, when you use the biomedical approach, and let's say you're using an antidepressant, we're really targeting symptoms. So we're recognizing that you have certain things going on, and it's leading to insomnia. So we'll give you something to help you with sleep. It's leading to depression. So we'll help you, give you something to help you with depression symptoms. Or you're having anxiety. So we'll quiet the mind. And so what we're really doing is we're approaching that from a biomedical approach, from just symptom management, and hoping that if we can manage your symptoms, you'll be able to cope better and, continue to work or continue to live to some degree. Now, when you do psychedelic assisted psychotherapy, what we're doing is we're kind of saying that all these symptoms are a sign of a deeper problem, that there's something obviously deeper going on here. And it could be a trauma that you're aware of. It could be a trauma that you're not aware of, that the brain has buried. And what we're saying is, instead of just, sedating the symptoms or managing the symptoms, why don't we try to search the brain by disconnecting from our ordinary thoughts? Let's go searching and look for what it is that could be causing all of this pain and suffering, and let's bring it to the surface, and then let's talk about it. And so what we're actually doing is we're facing the problem, and we're trying to digest it. And when you do that, you're going to get, all of your symptoms theoretically should get much, much better. So it's a completely different approach than the traditional, antidepressant approach.
Mm-hmm. I just want to acknowledge a comment that came from Tina Ray, who just wants to say that she's a veteran and she'll be doing this field trip program soon, and she finds herself hopeful that it will also help with her agoraphobia. So I just want to thank Tina Ray, and if either of you have any comment on that, that'd be welcome.
Yeah, thank you for sharing, and I wish you the very best in your journey. And I think the symptoms that you're sharing with us are very common symptoms that most of our patients have, that would feel, after a number of sessions, do improve. And so I expect you to start to feel a little bit more comfortable, reducing those symptoms.
So one other question that we've seen, we talked a little bit about the questions around street ketamine versus S-ketamine and all that, but really, why do this with trained professionals? What's stopping me from going to get drugs off the street and doing this by myself versus working with a professional team in a clinic or at home?
Well, one is just the inherent danger of not knowing what you're putting in your body if you're getting it outside of a compounding pharmacy in the U.S. You know, the container of the experience, you know, as Dr. Verbora's really spoken really beautifully about, this is a not just a biomedical model, right? Like the spiritual and the therapy component are integral for long-term clinical outcomes and really the deep integrative healing that we spoke of, right? What is underlying so much of depression and anxiety? You know, if you listen to Gabor Mate, you see the role of trauma in the epidemiology of all of these disorders, right? So really being able to go into that trauma and be able to heal, that is really critical. And you know, for people to do it on their own without medical support or therapy support, you know, you're just not going to have, I mean, number one, you can potentially be putting yourself in a dangerous situation because there are real medical comorbidities that are highly relevant for a drug as safe as ketamine. So we really want to make sure that, you know, we put safety above anything else. And then, you know, like all of the support systems that we have in both programs, you know, for anyone who signs up for the at-home program, they receive health coaching in addition to the integration coaching and the other clinical programs that we have. And that really is aimed at, you know, lifestyle, connection, detoxification, movement, all of the things that we know are going to be so critical. I mean, you know, Dr. Verbora was speaking about the work that it takes to really actually have, you know, a transformation, you know. So we are developing all of the tools and the programs to make that happen. You know?
That's a great answer. Thanks. Dr. Verbora, did you have anything to add?
Yeah, just bring it back to some of my earlier comments around set and setting, right? So, you know, even if you had a clean drug supply, which you won't know if you're just sourcing it from an unregulated source, which is where most of the drugs come today. Even if assuming it was a purely clean drug, the reality is where you do it and what intentions you have can be very different in terms of outcomes. There's a whole project called the Mendo Project that helps people use psychedelics at you know, raves and music festivals, because a lot of people go in with an expectation, but they're not prepared, and then they start having call it a psychiatric crisis in the middle of a music festival. So there's people trained to help you deal with it because you're going in and you're not even knowing what your expectation is. And so the challenge is that's a little bit more of the wild west. So it's you know, you're shaking the dice and you're going to see what happens, and maybe sometimes it's good and you get a great experience, and sometimes it can be a little bit bad, and then you don't have the right structure around there to support you. When you do it in a clinic setting, when you set intentions, when you have somebody trained to be a sitter, when you have a therapist or a life coach helping you kind of integrate it, when you close your eyes, you listen to music, you're going to be able to control that experience a lot more. You're far more likely to get the outcome that's going to be more healing and more clinically relevant.
Mm-hmm. Okay, thanks for that clarification. It's really important for people to think about that and what our services bring to the table on this type of mental health and wellness regime. Quick question, is there a minimum age for someone to participate in this treatment, whether they're doing it in clinic or at home?
We're only treating adults now, so 18 and up for us.
And great.
Yes, so predominantly it's adults. I think there would be, you know, cases that potentially we could treat younger people in clinic. It would obviously depend on the severity of the case. It's important to note that children get ketamine every day, right? So in the emergency rooms every day, they're getting 5 to 10 times the dose that we're giving in our clinics. So it's very safe for children. And, the problem is that you know, a lot of the children are still developing. A lot of their issues can be part of that social development. And so depending where they are in the course of their illness, it may be too early to intervene with this.
Okay. Caitlin, she joined a little late, she says, but she wanted to understand a little bit about how we work against people having a bad experience or a bad trip. And if you were to have a bad trip, would that actually make your... Dr. Hassan, maybe?
Okay, go ahead. Yeah, it doesn't matter. So, yeah, so first of all, to maximize the medicine, setting that intention and having, therapy, getting a clean drug supply, a regulated product with the right dose from a practitioner, and then doing it with the right music and the eye shades, that first of all is going to optimize your experience. So first you can control the things you can control, which is that, and that's what we can help you with, is to control that experience. And then the second thing is we don't know where the medicine is going to take you. Sometimes people can have very beautiful, blissful experiences, and then other time people will bring trauma to the surface, and that can be really, really pain activating because it's a very painful experience. But what we teach you is to try to recognize that as that pain comes to the surface, you're releasing it, right? Because that pain was stored somewhere, be it in the body or in the mind, which is causing you so many symptoms, which is typically leading to people suffering day to day. And so, one of the mantras we have in psychedelic medicine is better out than in. And so even though they're painful experiences, we want to get them out of the mind, out of the body, and then let's digest them and process them so that way you're not storing it in your body.
That's a really great phrase, Dr. Verbora, better out than in. That's something I'll be thinking about after our session ends. And even we have a great comment from someone, the Parachute people, who says that clinically guided psychedelic trips are the future of mental health. And we probably couldn't agree more.
Absolutely.
So we're getting close to the last 5 minutes of our time together. We have another question. How could a registered nurse or say other medical practitioners become more involved in this type of work? What would it take to become certified in some way? Dr. Hassan, maybe maybe you can just detail like a few of the like MAPS training programs and other stuff out there.
Yeah, there are some amazing psychedelic training programs across the country. Ketamine Training Center comes to mind. Polaris, the IIS, IPI. So I would direct any professional over to some of those programs for some education.
MAPS, Fluence. There's so many resources out there. Happy to reach out to us and we can send you a list of them. We work with nurses in our clinics. They monitor patients, they check their blood pressure, their heart rate, they do medical reviews. A lot of it's kind of on the job training. But I do believe that this is the future, and I think the earlier that people who are keen to get involved, the more opportunity that they'll have in being a bigger part of this field.
That's great. One last question I'm seeing is ketamine a helpful treatment for ADHD? Dr. Hassan, maybe you can take that one.
I haven't seen any literature or had any experience with patients with ADHD reporting a benefit.
Yeah, I would echo it. Unfortunately, I haven't seen scientific literature to validate it. I think if ADHD is part of a wider cluster of other symptoms, then we could probably be a little bit more concrete in its ability to help you if you have depressive or anxiety related symptoms with it. But yeah, it's not published yet, any data on it, but an interesting question that hopefully we'll have an answer to in years to come.
Mm-hmm. I actually love that characterization that something would be clustered like that. I think kind of go back to your point earlier that the medical system puts people into boxes, but they're really interconnected. So I love that characterization of being clustered.
Yeah, I think it's interesting the way we do medicine. We just try to tick off boxes, and then once you have enough ticks in a certain area, we give you that diagnosis, and we move on to the next diagnosis and tick off boxes. It's so strange to try to, you know, force people into these boxes and then give you a label, and then you only get treatments under that label. It's, you know, when reality is it's a manifestation of, you know, so much childhood trauma or upbringing or attachment theory. It's we know it, but yet the way we diagnose it is primitive.
Mm-hmm. I have just a few more questions for you. I've seen this question twice now. Is ketamine helpful for antidepressant withdrawal symptoms? Dr. Verbora, maybe that one.
Yeah. So again, I don't have any good evidence about, you know, they call it SSRI discontinuation syndrome. So it's a very good way of branding withdrawal. So I don't have any good, unfortunate scientific evidence to say that ketamine would help with that withdrawal syndrome that people get, which can be, you know, brain zaps or, you know, mood fluctuations, irritability. I think, you know, ultimately, you know, ketamine is a healing molecule. It allows you to go deep and pair that with therapy, and it's going to typically alleviate a lot of the issues that people experience.
All right. It looks like we've lost Dr. Hassan for a minute. Oh,
He's back.
Back. Back. I do have one more question for you. Is to say, is like, how does this treatment fit as a tool within a toolbox? You know, some people characterize this as a tool, but there's other tools, whether it be meditation, yoga. So tell me, how do those other activities support this work?
Absolutely. That's where we find incredible value with our health coaches, because we're reinforcing mindfulness, connection, detoxification, nutrition, and lifestyle changes. And all of that is just so synergistic with ketamine. With ketamine, you get a rapid reduction in depressive and anxious symptoms. And, you know, that's usually what's holding people back from doing all of the things that they need to do, right? It's hard to find the energy to go and exercise and, you know, connect with others. That's why you see so much isolation in depression, right? So once you start feeling better, it's easier to take those steps, and then and then it's just about you know, getting the right support to doing the real work of transformation.
Mm-hmm.
Yeah, I agree completely. And the way I look at it is you could do meditation and exercise and therapy, and you could get to a place where these psychedelic molecules, the effects that they have on you, you could get to that with meditation and exercise, but it might take you years. And most people don't want to suffer for years, and it takes months and months to form habits, right? The brain is slow to change habits, but when you take a molecule like ketamine, you get a rapid neuroplastic opportunity to just completely turn the car around and head in a different direction with great motivation. And then when you pair that with therapy or coaching, we can start to instill those other behaviors that give you that long lasting, you know, durability on reduction in symptoms.
That's great. As we're wrapping up, I just want to call out that if anybody watching has any questions or wants to know a little bit more, please health.com/at-home. That webpage will answer some of your questions and help you get started on what's the best treatment option for you. And as we close today's session, I actually just wanted to give a little bit of space. If either Dr. Hassan and Dr. Verbora, if you have any kind of like closing thoughts, or you know, if there's something that you'd like audience to take away from today, what might?
Dr. Verbora, after you.
Sure. I just want to thank everybody for joining us and being part of this movement and this community. It takes a ton of courage to confront the demons that lie within you, and we all have them, and nobody's exempt, no matter, you know, what part of society you play, what role you play. And it is so necessary to engage in that healing path to create a better world. And it's the only thing that we have power and control over, is to make ourselves the best version of ourselves. And we know that if we focus that energy there, then slowly the world will transform to a better one. And so I thank everybody for having the courage to be part of this community and to do the healing for themselves, because ultimately it's a contribution to society.
I love that. just as Dr. Verbora said earlier, you know, ketamine as a telescope into human consciousness, using this medicine to really just sit and be with yourself and listen to yourself, and, you know, just turn off that judgment and just experience. I mean, that is an incredible gift that we can give our patients, right? Not just in the medical context, but just as conscious creatures, to really just experience that level of mindfulness, and then be able to really integrate that back into your life, into all of your other relationships, and, you know, just carry that with you, you know. So I love meditation as just a tool for self-discovery, and, you know, I think this is just one of the greatest amplifiers of mindfulness, you know, these spiritual experiences.
That's fantastic. Thank you so much to both you, Dr. Verbora, to you, Dr. Hassan, to all of our audience members who attended and participated and asked really, really wise and insightful questions. Thank you so much. We're really grateful to have this opportunity to connect and chat, and we're always here for you. Again, please feel free to visit fieldtriphealth.com/at-home if you wanted to learn a little bit more. And we'll be so excited to kind of continue this dialogue with you, and hold this space as we move forward, and as our service and our industry evolves.
Conrad, I'll just add, I just think this is just so incredible, the marriage of these two companies. I mean, it's just so clear how mission aligned we really are. And, you know, just getting to know the clinical team, you know, with the addition of Dr. Ben Medrano over to New Life, Dr. Lynn Marie Morsky. I mean, we've just, you know, like, been so blessed to be able to do this work together and change so many lives. So I'm very proud of what's happening here.
Yes, thank you for saying that, Dr. Hassan. We feel the exact same way, and we look forward to doing more healing work together as we move forward.
Yes. Thank you so much.
Okay, thank you so much, everybody. We're going to end our live session now, and we look forward to seeing you again soon.
Take care.
Bye-bye.